All right. I think we are live in our Facebook group, ladies and gentlemen. I'm going to turn off that thing. Anyway, if you are watching live, please comment live. If you're watching on the replay, please comment replay. I see people who are watching and logging in. I'm trying out our new system. Well, anyway, I've been going live on my different groups and different, what do you call this? Different Facebook page. But I wanted to serve our Alzheimer's and dementia support group, ladies and gentlemen. So if you got any questions, shoot up a message here. But I've been reading our group. I've been reading and following our group. Follow those people who are actually our moderators in the group here. Lisette, she's been serving our group very well. But I wanted to read some of the questions here real quick. Thank you very much for Marilyn. Thank you, Miss Marilyn, for watching. Marilyn O'Malley. If you are watching live, please comment live. If you're watching on the replay, please comment replay and then put down what city and state you are in. All right, so let's go ahead and read some of the questions here that I've been reading. Some person asked, can you give too much CBD oil? Yes. A lot of people would always say, no, it's okay. But technically, yes. Just like any food, just like any other thing. If I drink too much water, guess what? I'm going to start peeing, right? If I drink too much coffee, guess what? I'm going to start peeing too, right? Same thing with any kind of medication. You can give them too much. You can give them too much. So you got to be careful with it too. When it comes to that, you always want to ask your physician, your loved one's physician when it comes to that. It could interact with other medications. All right. Next question here. I see it. Hi there, good Samaritans. I'm caring for an elderly lady with Alzheimer's. Please help as I'm on the wit end on what to say to encourage her to take a shower. All right. First, you have to identify what stage your person is, what stage your loved one is. In that way, you can learn how to redirect them. There's different stages, so you have to identify which stage. In that way, you will learn how to redirect. If you want to know the different stages, I think we have those other posts here about different stages. But you got to check out Tipa Snow. If you know Tipa Snow, watch all her videos because those are amazing. She stages different patients on a different different gyms, and then different gyms or different stage has different approaches. So different stages has different approaches. So obviously, for early stages, you have to be realistic to them. For the later stages, you have to go along with them, go into their world. So, for example, for taking a bath, imagine when you have Alzheimer's and dementia. Okay, when you have Alzheimer's or dementia, that's the group here, right? You have problems with sensations already. You have problems with seeing, hearing, feeling, and everything like that. So imagine if I wear eyeglasses. I take off my eyeglasses. You take me to the bathroom. Guess what? It's so cold, right? And I don't see it. And then all of a sudden, there's water rushing through me. Guess what? I'm gonna get confused. I'm gonna be irritated. That makes sense. So you have to know first what stage your loved one is, what stage your patient is. For example, of course, with the hearing, when they're hearing this rush of water, like a big flush of rushing water, guess what? They're going to be agitated or confused, right? Okay. All right. So let's go on to the next question that I saw. Is my mom got diagnosed with Alzheimer's last year. She's 80 years old. She's still trying to prep her food, takes a bath every day, but has a short-term memory. I'm taking care of her, and I'm new. And then it's a continuation that the loved one, the patient, is in Germany, and the current person who asked is here in the States. Well, guess what? You don't want to remove your loved one in a different, or take her to a new environment, that because that will actually going to confuse them more. That's going to confuse them more. Imagine here in the States, we have patients who are living at home, and then we take them to the nursing home. Guess what? They get confused. They get confused. So try to make sure to put them in a situation where they are actually in their previous living environment. There's another question here from Marilyn. I have a question. I'm a caregiver to my aunt. When she is on the phone, she seems like she's perfectly fine. Then she comes out today with her pants backward. All right. That is such a great question, Marilyn. First of all, thank you very much for that question. Second, yes, there's what you call a period of lucidity. Period of lucidity. When you are talking to a patient, they will remember the long-term goal, the long-term goals, the long-term stuff, the long-term memory. And then guess what? It also affects their short-term memory. So imagine, let me take that off again. Imagine you've got a filing cabinet, right? Filing cabinet, short-term memory is right here. Long-term memory is back there. When you have Alzheimer's and dementia, what happens? The memory, your short-term memory is gone. You take off that filing cabinet, that short-term memory, and what's remaining is the long-term memory. Imagine that's the filing cabinet. And same thing with the brain. So if you got a brain, right? You got your brain like this, and then the superficial, or what you call the cortex of the brain, is there. What happens when you have Alzheimer's or dementia? It shrinks. It shrinks. Well, guess what? When it shrinks, those are the short-term memory. Inside the brain, is actually the long-term memory. So most of the time, when you talk to them about what they ate 1975, 1982, they would remember it, but they will have a hard time remembering their short-term memory. When you mentioned about her pants, those are what you call the coordination. Their coordination. There is the part of your brain called your basal ganglia and your cerebellum. It's the back here. It's the back part. And it affects your coordination, your rapid alternating movement. That's why they have a hard time walking. They have a hard time coordinating their movement. They're not able to put on their pants on properly. Even their shirt, they have a hard time putting it on. So that's a great question. That's a great question. There's somebody here, Facebook user said, very true. Thank you very much. There's another question here. How can I explain if she is in the moment but forgets? Yeah. Could you expound that, Marilyn? How can I explain if she's in the moment but forgets? Yeah. They will forget the short-term memory. They will, like what I said, they can remember what they ate 1985, but they cannot remember what they ate this morning. So that's how it is. That's how the brain works. And you cannot selectively choose which part of the brain shrinks, right? Some part of the brain shrinks the front part. Some part of the brain shrinks on the lateral part, or your temporal. So what happens is that's what you call temporal or frontotemporal dementia, FTD, frontotemporal dementia. So it just really depends on what side. Some patients, they have problems at the back part. What's the back part of your brain? It's your vision. It's your vision. So some patients, if it's a real dementia, okay, if it's a real dementia, they have visual hallucination problems. Now it's different when you have a patient who has what you call this, they're delirious. That's a different story. But if it's a real dementia and it affects the back part of your brain, so they have some hallucination episodes. So right, thank you, you're welcome, Miss Marilyn, appreciate you. All right, I think there's another question around here that earlier that let me go to the comment section. Well, anyway, I can't see it anymore. But for those people who still wants to more information, you can get a free copy of our book called Misunderstanding Dementia at our website, drmikechua.com. Just check that out, drmikechua.com. Yeah, I'm looking at their thing right now. So yeah, drmikechua.com. It's called Misunderstanding Dementia. It's free. It's an ebook. It's a PDF. If you want an actual copy, you can buy it at Amazon. Just Google it or search in Amazon, Misunderstanding Dementia. I think it's just $3.99. It's very, very affordable. I don't even earn anything. I mean, probably like 5 cents or something. We just have to put some sort there. All right. And then, of course, before I let you go, we also have what you call the Alzheimer's and Dementia Seminar. It's what you call this? It's the required course to be a certified dementia practitioner. I don't think I can see it right now, but it's called the Alzheimer's Disease and Dementia Care Seminar. It's the required course to be a certified dementia practitioner. So if you are a nurse, a therapist, a physician, or anything that if you're a medical professional, come and join that. We do it every month, every week, every month. I teach that class. So all right, I see Mauricio. Dr. Chua, what is the best advice you can give to someone whose entire family is in denial and detached that their loved one has dementia? Oh gosh, that is very, very an interesting topic, Mauricio. Mauricio, where are you from? Well, anyway, let's talk about that. Okay. Most of the time, we try to change other people, right? We try to change our patients. We try to change other people. We try to change other people, right? So let's just talk about that stage, that denial that you were talking about. So let's talk about the different stages. The first stage is what you call the denial stage, wherein they will deny that they can still do this and they can still do that, and attempt to do that they can do it if they can do it before, when in fact they can't do it anymore, right? So that's the denial stage, because the patient and the family goes through it too. The caregivers, the loved ones. So that's perfect. That's a nice question there. So the patient will encounter going through the denial stage. The next stage, what you call the anger stage, wherein they will start getting angry because they cannot do what they used to do before. They're going to get angry because they cannot express themselves anymore. So there's what you call the 90-second rule. It takes them 90 seconds to process the information. If they cannot process that information, guess what? They get mad. Me, English is not my first language, so if I get sick, for example, I get COVID, knock on wood, or get the flu or whatever, I don't want to talk to my kids. I just want to talk to my wife who speaks my native language, right? So they will get angry or humorous because they want to learn and they want to mask that. They want to mask that dementia, right? And next would be the bargaining stage. They're going to bargain with you, bargain with priest or God, or bargain with the higher being, and bargain with the physician. So you will notice this. Some patients, they are all dressed up. When they go to our clinic, they're all dressed up, nice and everything. They go home, they don't even want to take a bath. They go home, they don't. They have a hard time being taken care. They go home, they don't want to take their medication. But when they are at the doctor's office, guess what? Boom, they're so good, right? They're so perfect, right? So that's the bargaining stage. Next stage will be the depression stage. By the word itself, they're going to be depressed. They don't want to do anything. They just want to stay in the chair and stay, in the bed and everything. When the patient reach on that depression stage, okay, this is for the patient and for the caregiver, okay, for the patient and caregiver, for your loved ones and for the care partner. You have to do three things. First is actually coaching and counseling. You need to have a coach. You need to have a counselor, wherein you, not only as the patient, you as the caregiver and the patient needs to go to a coach and a counselor. Go to your pastor, go to your physician. Well, who can you talk to? Physicians don't even talk to you anymore, right? Go to a nurse, a social worker, wherein you can actually express your concern. So coaching and counseling, the three things. When you're on that depression stage, right? You need to do three things. It's like a chair. It was not stand up. It was like a stool, three-legged stool. It's not going to stand up. So you take one off, it's going to fall. That's the reason why a lot of people or patients get stuck on that depression stage. So first, coaching and counseling, right? Second, you need to have medication management. Your medication needs to be adjusted. Your medication, not only yours as a caregiver, but also the loved ones, because every day is different. Every day is different for your loved ones, for your patient who has dementia. One day you need to adjust the medication, one day it's going to be the same, right? So you need to go to an actual good, a physician, a good nurse practitioner, a good PA, or a good nurse that will learn and teach you how to titrate and how to adjust. Oh, today I need to add this medication to my mom, or today this is okay today. So they need to teach you, because every day is different for these patients. That's why there is what you call the PRN, as needed medication, right? So you got to talk to them. Don't just self medicate. Don't just oh, I'm going to take this off. You need to talk to a doctor about it. Okay. And then the third thing is actually therapeutic exercise, therapeutic activities. You need to move. You need to move. You as a caregiver, you need to move. Why? Because movement matters to your brain matter. If you already have a loved one that has dementia, the risk of you having dementia or Alzheimer's increases. I'm not saying that you're going to have it, but the risk increases. So you have to make sure you're exercising and moving too. All right. And same thing with your loved ones. They need to exercise. That's why we recommend physical therapy. I'm a physical therapist. So we recommend physical therapy for your patients so they could improve their blood flow towards their brain. What happens when there is not blood flow to the brain? What kind of dementia that is? Vascular dementia, right? Vascular means the blood flow to the brain. If there's no blood flow to the brain, you get vascular dementia, or, stroke-like dementia. Well, thank you very much, Mauricio. Thank you very much. I hope I'm pronouncing your name right. Yep, that is so true. So let's go back again on what you said. How can you tell your family members? You mentioned about what is the best advice you can give to someone who's the entire family is in denial. They will go through that stages, brother. They will go through that stage. They will have a hard time, actually, the family itself. I had a hard time accepting my dad that had, mild cognitive impairment, MCI. MCI is a precursor to Alzheimer's and dementia. When a patient gets sick, when a patient, get whatever kind of sickness, they will have a mild cognitive impairment. I had a hard time accepting the fact that my dad was having problems with his memory. I was having a hard time. I was denying that my dad is not sick. I was in the denial stage too. I cannot accept the fact that he cannot even stand up and walk and go to the bathroom without help. And patients, or your family will actually go through these stages. You just have to guide them very carefully. Hey, right now, this is what mom or dad is going through. You just have to explain to them, and they will get mad at you. I got mad. I was depressed. But they need to go on to the next stage, from denial to anger to bargaining to depression, and of course to acceptance. You need to just walk them through that situation. All right, let's go on and move on forward. Patricia is asking, my husband can understand everything we say, but can orally verbalize understandable responses all of the time. He was diagnosed 2009. Thank you very much, Miss Patricia, for pointing that out. Okay, so that is actually a very good question. She is asking, my husband can understand everything we say, but can't orally verbalize understandable responses of all the time. So let's just talk about what you call aphasia. Aphasia, when you break it down, is absence, phasia is speaking. So there's what you call expressive aphasia and non-expressive aphasia. Okay, it's going to be too technical. Okay, I'll try my best. Okay, so when you say the two types, right? Expressive aphasia and non-expressive aphasia. So one aphasia is wherein they can understand you. Okay, they can understand you, but they cannot express themselves. Okay, so they can understand you, but they cannot express themselves. The other one is they cannot understand you, but they can talk like they know they're understanding. Okay, did that make sense? So the second one is they cannot understand. I cannot understand, but I'm able to talk like I feel like I know I'm understanding. So you have to go to a good therapist, to a good therapist, to a good physician, to a good speech therapist or whatever. In that way, you could identify what kind of aphasia is my loved one. What kind of aphasia, what kind of understanding my patient or my loved one is. Now, there's different stages too. Again, are they able to follow simple one-step command, two-step command, or three-step or whatever? So from there, you can identify and learn how to use and change your approach to that specific patient. Okay, so every patient again is different. Every aphasia again is different. Whether it's non-expressive or expressive aphasia, they're both different and different approaches. Okay, so in general, that's a great question. Okay, so in general, if you're having, whether it's both expressive and non-expressive, the general rule is to make sure you ask them questions that are answerable by yes or no. Okay, never, not never, try to limit your question to what you call closed-ended question. What is closed-ended question? Closed-ended question are actually answerable by yes or no, right? So if you have an open-ended question. What's an open-ended question? What open-ended question is a what question, right? So for example, hey mom, do you want what do you want to wear today? They're gonna process it. Once they're processing it, guess what? Once they process it, they cannot process it. Guess what? They're gonna get mad, right? They're gonna get mad, and then here they are. Oh, whatever, give me whatever, right? And then here you are bringing that blue shirt, and apparently they don't like that blue shirt, and now you're upset too as a caregiver. So you as a caregiver, you need to change your words, you need to change your behavior, you need to change your approach, and you need to change your words. In that way, you can get more out of that patient or out of that loved one. So if you ask a question that is actually a close-ended question, like a yes or no. So you ask them, hey mom, what do you want to wear this blue shirt? Well, you can at least get a 50-50% of getting the right answer, whether they're an expressive or non-expressive aphasia, right? So at least you get a 50-50% chance, and you empower them. You give them the capability of decision making skills. All right, okay, all right. So I hope I was able to answer some of your questions. So again, before I let you go, if you are still there, please comment live. If you are on the replay, please comment replay. But before I let you go, I'm going to remind you again, the Alzheimer's Disease and Dementia Care Seminar, the required course to be a certified dementia practitioner, this coming August 29 to 30, next weekend, I think. And that way we could help you bring out the best in you and learning how to be a dementia practitioner. So that's it, the Alzheimer's Disease and Dementia Care Seminar. It's actually through the National Council of Certified Dementia Practitioner. All right, again, I wish you all the best. Well, thank you very much, Patricia. Appreciate you too. Thank you so much for clarification, and appreciate you too, Mauricio. And again, all right. Well, again, appreciate you, ladies and gentlemen. If you got any questions, reach out to our moderators. You will see them here, and we will try to do more of this show. We will try to keep it regularly. We used to do it every Tuesday, but we've been busy. We're so busy. But if you got any questions, just post up above here. And then I wish you all the best. Be awesome. Be great. Be excellent. And I will see you around, my Facebook friends. You have a good day. Bye-bye.